it's reactive healthcare here. If I am trying to do something to prevent disease, it's actually really tricky, and insurance doesn't really want to cover any of those services.
40% of the weight you lose on GLP-1s is attributed to muscle loss, and that is detrimental to everything in your body.
One of my patients, she comes to see us from India. The woman is in her 70s right now and only on one medication. How cool is that? Do you know what the medication is? Vitamin D.
If we protect muscle, muscle is the longevity of our youth.
Right now, I exercise about 20 minutes a week. I do use testosterone supplementation, and I've gained probably in the past year about 10 pounds of muscle and lost about 20 pounds of fat.
Hey everyone, Sam Patel. Welcome back to the podcast where we talk about the latest trends and topics in aesthetics and wellness. And so that way you can take actionable items in your clinic and take care of your patients better. I'm so excited for today's conversation because I have someone that I know very well, Dr. Dom, that it's welcomed here in Chicago. She has a beautiful practice called Balance Flow, and she does amazing work in the city of Chicago. Dr. Dom, how you been?
Thank you for this beautiful introduction. I'm doing great. Spring is around the corner.
I know. The weather is starting to come out, and it's finally we're defrosting and feeling a little bit better.
Yes, all of it. No, the clinic is thriving. Patients are feeling fantastic. So today, nothing to complain about.
Hey, listen, that's a win to me. I can't expect any better. I'm happy to know this. We're going to talk about some fun topics today. I think topics that actually you are going to be quite interested in discussing because this is your expertise. So really, I'm here to learn from you. And I'm looking forward to having this conversation. And the first topic is something that we know exists, and we know there's a massive sort of evolution and transition from conventional medicine, so the medicine of, hey, prescribe, and treat, versus functional medicine. And what's the difference between the two, and what are your thoughts on it? And kind of, I know where your philosophies are, but what are your thoughts on this sort of evolution and transition from one world to the other finally? But what are your thoughts?
I am so excited that it's finally happening. I grew up in Europe, in Poland specifically, and when I was younger, really preventative care was all that healthcare was about, right? And then I moved here, and now when I'm aging, I know you can't tell by looking at me, but I'm in my 40s right now.
Wow.
Where it's reactive healthcare here, right?
Yeah.
If I am trying to do something to prevent disease, it's actually really tricky, and insurance doesn't really want to cover any of those services.
Absolutely.
So several years back, being the proactive human being that I am, I thought, what the heck, that's wrong. How do we change this trajectory? And even though we were at the very beginning of this change, we're now in it, and I am seeing more and more healthcare providers changing the way that they look at medicine and spending more time with their patients, more time on preventative healthcare, and hopefully insurance costs will go down as well because of that.
Right. And it's very eye-opening to kind of hear that you were used to this before.
Yeah.
And coming to the U.S., it's such a different way of healthcare. And listen, the healthcare system in the U.S., everyone's got their opinion on it. We have amazing health, but I don't think we're operating it that well until recently. And this whole concept of, hey, instead of giving medication and putting Band-Aids and all those things even have symptoms and side effects, why not just treat the root cause? And you at Balance Flow, you guys have been doing this for a long time. You've been doing it before functional medicine was a hot topic. Walk us through some of the things that you feel have been very, rewarding, and maybe even some of those treatments that you do that are not conventional, that are very functional.
Sure. So some of those things are still huge eye-openers for my patients here in Chicago. So things like peptides.
Yeah.
Right? Hormones, and even different approach to pain.
Right.
One of my patients, she comes to see us from India. We're not that special. She doesn't just come to see us. She comes to see her family, but every time she's here, she comes to Balance Flow. And she's had a bunch of treatments done with us. The woman is in her 70s right now and only on one medication. How cool is that? Do you know what the medication is?
What?
Vitamin D.
That's not even medication. Yeah,
I know.
Just a vitamin. Yeah,
It's fantastic. So we use treatment. We use very different approach to physical therapy as well. Our practice is concierge physical therapy and health optimization med gym. Right? So on the physical therapy side, we always looked at what a patient wants to achieve. What is the goal? If you want to run a marathon, that's exactly what I am going to help you do. If you want to get out of pain to be able to pick up your kid, that's exactly what I'm going to do, as opposed to using the cookie cutter treatments that some other providers
You're
were using.
considering their life as well of like, what are your goals and how do we get you there, rather than, oh, pain, pill.
Right.
Like, why is it the pain, and why is the pain important to you, and why do we need to get rid of it? And the why is actually such a powerful thing to understand. So we can, I love that. That makes perfect sense.
And we don't want to keep our patients with us forever.
Yeah.
We're here to teach them how to live better, optimal, fantastic lives, right?
Yep.
So I think that's what was different from the get-go. And then as we started to age, because we opened our clinic, over a decade now, we noticed that sometimes you need a little bit more than just a little physical therapy.
Yeah.
And we started to have patients asking us what to do if I am perimenopausal. What do I do if I am experiencing erectile dysfunction?
Yeah.
And they didn't really want to start using conventional medicine and medications.
Right.
Because, all of these have side effects.
Yeah, terrible side effects.
So we started digging in deeper and deeper. I spoke to a bunch of my colleagues in Europe as well and figured out what treatments we can bring, what's working, what's not working.
That don't require medications.
Yeah.
I love
don't require
that.
medications.
Peptides are on the rise and hormones are on the rise. These are all things that our body already has. So why don't we just go back to giving our bodies what is deplenished over time? And we lose these things, and that's normal. As we age, we lose muscle, we lose our collagen, we lose our youth, we lose our, our beauty. But we also lose the molecules that exist within us. And sometimes it's just fighting a battle with giving pills. Why don't we just optimize those things? Like you mentioned, your patient, the only vitamin she's taking is vitamin D. I mean, that's a great life to live, just having that as your primary medication when you're in your 70s. That's inspirational. I think you're absolutely right. If we balance these, balance, no pun intended. If we were to balance all of these things, it makes perfect sense. So what do you think is going to happen over the next, years to come? I mean, we're seeing this huge spike of people paying attention. Do you see this as more of a generational shift where the younger people are doing, or do you feel like even our older generations are paying attention? What's causing this movement, in your opinion?
That's such a good question. I know that the older generation is still a little bit skeptical, but even those people are slowly starting to convert. Right. I know some old school doctors who are stuck in their ways, and they still tell their patients that there's only one way and no other way, prescribing antibiotics for everything and statins right and left. But the younger generation, they want to do better for themselves because they see how things are done in different countries. And it's not to say that we're screwing up in the US. We're not. Sure. Still, the emergency medicine is the best in the world here, isn't it?
Yeah,
right?
It is.
But then, like you said, if you take one medication, you have to take another one for side effects, and then another one, and then you become a prisoner to meds, and no one wants that.
I actually love the way you said that. You become a prisoner to medications. It's so true because it's a cyclical effect. And why not just go to the root cause? And also now with insurance, which is a whole other topic, but it gets expensive, and we have to worry about coverages, and does it cover this? And then if you don't get coverage on this list of medications, why not just go back to the root cause, right? Let's go functionally treat these patients with peptides, with muscle health, with actual proper treatments to balance our bodies, rather than just, throw it into a shamble. And like you said, we become a prisoner. I love that, prisoner in our own body. No, this is great, and I appreciate the context. A couple more topics in regards to this that I would like to highlight is now we're starting to see technology involved, right? We're starting to see not just, hey, let's balance the hormones and optimize the peptides and vitamins and all the amazing things that we have biochemically, but now we're starting to see the use of technologies, energy-based technologies, and we don't have to go into specifics, but now there's ability to actually regain muscle and actually enhance our tissues and our collagen and the way. What is your thoughts on technology being used? Do you use it? Do you feel like it's necessary?
Yeah, I'm obsessed with technology. That's why I'm at gym. That's what we do.
Yeah.
A while back, it was a couple of years ago, I was sitting with my friend Jay, and he lost a lot of weight, and he looked fantastic. So I was like, what are you doing, Jay? As we were drinking more wine together, which I don't recommend, and I was bad for you, whatever. He told me about all the fun things that he's doing. And interestingly enough, that same evening, my best friend who lives in Poland, she's paralyzed from waist down after meningitis when she was in high school. She said she's using the same technology in Poland to maintain muscle mass in her legs.
Wow.
So I thought, okay, gotta find it, right?
Yeah.
So again, not to get into too many specifics because, we have Emsculpt and other companies. I invested in an EMS machine as well and started using it myself. So right now, I exercise about 20 minutes a week. I do use testosterone supplementation.
Sure.
And I've gained probably in the past year about 10 pounds of muscle and lost about 20 pounds of fat. So
that's insane. Just by keeping the hormones in check, and then on top of that, doing some muscle stimulation technology, and you were able to gain lean muscle mass.
That's exactly right.
And that lean muscle mass, a lot of people are like, oh, you gained weight. But no, you gained lean muscle mass. And now the lean muscle mass is probably going to allow you to actually have more organic production of hormones and also increase and maintain your metabolism. That's needless to say. You're quite young still, but as we age, we want muscle, right? We want to make sure that we are strong, so we are stable. We have better posture. We have, things that, of course, you guys focus on a lot. So it's so simple. If we protect muscle is the longevity of our youth.
Thank you for saying this, because right now we are all in love with GLP-1s.
Yeah.
Right?
Yeah, there's a massive craze.
But what happens, as you know, 40% of your body weight is lost in muscle.
Do you guys hear that? Let's repeat that again. 40% of the weight you lose on GLP-1s is attributed to muscle loss. So people get excited. Wow, I lost so much weight, which is great. But you didn't just lose fat. You also lost muscle. And that is detrimental to everything in your body. That's detrimental to, of course, immediate things, such as you just cosmetically, people look different.
Sure.
I mean, we're seeing that with the face, Ozempic face and semaglutide, tirzepatide face, whatever you want to call it. We're seeing that, of course, in the body. People just look kind of gaunt and look like they almost had an illness. So cosmetically, it's not fun. That's the immediate ramifications. But the long-term ramifications are hormone, metabolism, strength, balance, stability, cognitive changes. You're absolutely right. So this is an important topic, that muscle is the longevity. I always call it, it's the fountain of youth.
It is.
It's the one thing we've neglected for so long. Yes. But now this technology that you're mentioning, the different technologies allow us to maintain it, because it's wishful thinking to tell a patient to go work out. I mean, have you had success with saying, hey, just go to the gym?
How many people do you know who truly love working out?
I can count on one hand.
Right?
Yeah, that's
if
true.
If we work out, it's because we know we have to, it's good for us, or because we socialize.
Yeah, that's true.
But not because it's like, oh my gosh, I get to go and lift weights today for 2 hours. No.
Right.
What is time for that?
I think a lot of people may even see it as like a cheat code. It's like, oh no, like that's fake. You shouldn't be doing technology. You should actually just go work out. And, listen, that's the same thing with medication. Should you just let yourself heal? Right? If you need medication, you take it. If you need vitamin D, you take it. It's
totally.
If there's the resources there, you take it. What is your opinion on using technology as a cheat code?
People say this all the time. Yeah. It's like wearing a badge of honor because I go to the gym and work out for 2 hours a day, but it's not. Right. When you reheat your meal, are you going to pull out a bunch of things from the fridge and then cook it on your stove, or are you going to pop it in the microwave for a minute?
That's a good way to put it.
Like literally, it's the same thing, right? You're going to eat it and you're fine. So I have nothing against it. I'm not going to wash my dishes with my hands. I'm not going to wash my clothes with my hands either, because I don't want to and I don't have time for it. I have technology. I have smart people who develop technology that works, is scientifically proven to do the job. So
it's true. We use technology every day, and in the cell phone, we call people, we send a text. We don't send a piece of mail anymore, or a pigeon, right? I mean, those days are gone. Technology provides convenience. And if now technology, which it can provide convenience for your health, hey, I'm all about it.
Yes.
So let's kind of transfer into a new topic, one that's kind of synergistic and synonymous with what we were talking about, which you mentioned pain, right? We talked about, all of these components, muscle health, hormone optimization, and having a healthy weight. And if those things aren't figured out properly, pain transpires, back pain, joint pain, all of these different things, no matter the age, mind you. And I just read an article recently, and it was all over the news, that there's this new medication, and opioids are terrible, right? They're great for getting rid of pain, but they're terrible for everything else.
Terrible.
Side effects, addiction. People just go off the ledge when it comes to these things, and it's sad. And our nation needs to do better. Let's just say it how it is. They need to do better. And I think finally the FDA just recently approved a medication called I might butcher this name, but suzatrigine.
Okay.
And this medication is a non-opioid painkiller that focuses on the sodium channels, from my knowledge. I don't know too much about it, but it sounds promising. The anesthesia and pain communities raving about it. Now, when it comes to pain, I know we don't know much about this medication, but what are your thoughts about pain and this effort finally to bring something into the world of use, but also other alternatives for treating pain? What are your thoughts?
Pain has so many factors, right? And you're absolutely right. The opioid epidemic was real. There's actually a great book. I forgot the title right now, but I'll send it to you later, about how it all came about and the creators of opioid medications.
Right.
I mean, wow. It was a great read. First, we need to address why the pain started in the first place. What is the root cause of pain?
Yep.
Is it surgical because you had an accident and needed to surgically change something? Is it something else? Is it fibromyalgia, which we could also talk about for hours?
Right.
And then when you figure out what it is, it all boils down to balance. Again, balance in your body. How are your muscles doing? Are you moving properly? What's your range of motion? And checking your hormones internally as well. I have seen huge success in eliminating pain, even on people who we thought would be a lost cause.
Really?
My nurse practitioner, whom I mentioned to you earlier, Laura Lee, she works for a pain clinic. She works with opioid addiction specifically.
Wow.
And some of those patients transferred to us.
Really?
And we're seeing just tremendous success.
Have you seen patients come off or at least decrease medications?
That's the whole idea.
How amazing is that, right? Is that you almost, in a way, save their life, not like sometimes physically, but also emotionally, because sometimes they feel so defeated by just being on these medications, excessively needing them. And sometimes they hit this road where sometimes they don't even have access to them. And that's where they go into other lines of drugs. And so I'm happy to hear that, this is a focus of your business, because pain is something that we're going to continue to see. And people always think, it has to be something with age. If you have an injury, to your point, you have an injury, you have a leg injury or knee injury. If we don't strengthen the muscles and rehabilitate those muscles and figure out, hey, let's treat that and then maybe have relief on that knee. Rather, it's like, no, you had surgery, you still have pain. Well, sucks to be you. Let me just give you opioids. But the alternative therapies, the devices we talked about, that sort of technology, or physical therapy, or doing things the right way and going to the root cause. I think that's the biggest thing, is that pain always has a root cause. And if we address that root cause, oftentimes we can actually eliminate or decrease or completely avoid opioids and pain medication. Do you feel like that's a valid statement or a bold statement? Thoughts?
It's a bold statement and a true statement. And I really hope that this is the trajectory we're going in.
Yep.
As more providers are doing what you and I are doing and talking about preventative healthcare and talking about different ways to heal the body and optimize it.
This was not originally something that I wanted to actually discuss, but it just provoked a topic. And that's the beauty of these conversations. We just let it fly. And pain isn't just with body. Sometimes we have mental pain. Sometimes we have this sort of, man, I feel so tired. I feel so stressed. I feel burdened. I feel defeated. I feel depressed. Mental wellness is something that, we've really not spoken about, at least in our practices, in the history of our practice. It's not that we ignored it. It's just we've never really talked about it. We've never addressed it. We're not psychiatrists. We try to not. We stay away from it, to be quite frank, because it's not our science.
That's tricky.
But it's tricky. Best way to say it. And I think that mental wellness now means so much more. We don't have to have depression to have mental wellness needs. I mean,
oh my gosh.
Could you be less stressed? Yeah.
Could you be? Yes.
Could we improve on our sleep? Probably. Could we, maybe have a little bit more motivation in the day? Could we maybe cope a little bit better instead of leaning on cigarettes and alcohol and eating excessively? Could we maybe cope with our emotions a little bit better so we don't do those things? Mental wellness, is this something that, is a focus, or what are your thoughts on mental wellness? And because it's becoming a hot topic.
Yeah.
Are people coming to you? Are you addressing it?
Yes. So this morning, I actually had a conversation with my husband over breakfast about mental wellness. My mom She still lives in Poland. She's always like, oh my gosh, everyone is depressed right now. When I was young, I had to milk the cows in the morning, run to the train, and go to university.
It's almost like depression is shamed, right?
Right.
Yeah, the same thing with my parents. Like, that's a generational thing.
It's a generational thing. But then I dug deeper into it, and she's right. And she's right in some ways. Because think about what our parents ate.
That's
right?
true.
So
They ate very pure.
There's so much research right now on gut brain
I love
axis.
this topic. Yes.
So she ate very clean. She moved all the time because she had to go and milk those cows in the morning, right?
Right.
So she moved all the time.
Yeah.
And I think that was partially, and she had a purpose.
You know, there's very few times that I hear sort of discussions from like, whoa, I've never thought of that. I've always thought about this older generation and our mentors and our parents and our grandparents. They're like, depression's not a thing. And I've always been like, come on, dude, it is a thing just because you have this sort of, ego. But you're right, though. I think that maybe it wasn't a thing for them entirely because of how they ate. And, was depression a thing back then? Sure. But as much as it is now, no, because you're absolutely right. The whole gut and how that impacts the brain and how what we eat and the bacteria and the flora, even in our mouth, how that impacts our brain in a lot of the degenerative diseases with the brain, like dementia and Alzheimer's. I think that this is actually such a big topic. We're going to have to meet another day for this because
we will. This
is something that you're actually right, is that it's not just about the social aspect, right? Like technology is causing depression. Yeah, I think there's something there to it, right? Screen time and social norms and influences in our youth. I do think there's a massive impact on mental health there. But you're absolutely right. It's also food. And it's also how that food impacts us and how that food inhibits us from producing, our normal metabolites, our more normal, molecules like
GLP-1s even.
Yeah, you're absolutely right.
Because we produce it ourselves, right?
GLP-1s, for those of you that don't know, we make this normally. It's normal. It's not an inorganic substance. We just have to supply it because our bodies don't make it as much anymore, and that's because of food.
Yeah.
Brilliant. I love that. Let's go on to our last topic. And, this kind of actually goes into a little bit. This is a beautiful transition. This was not planned. Beautiful transition. We talked about screen time and social and all the impact that our youth now faces. We're always on the cell phone. We're always on the internet. And we have access at all times for information. We're on social media. We can go to a news. We can go to Dr. Google. Everything is there at our disposal. Now, although that's amazing, technology's come, AI, we can ask it, it gives us an answer, but it has its consequences. It has its downfalls. And that downfall that I would love to talk about is misinformation. Misinformation when it comes to our patients going online, getting information about maybe a pain they have, maybe, an issue they're dealing with, a concern they're challenged with. And they say, hey, this is the remedy for that. And then they come to you and say, hey, doc, I need this. This is what I need. Or if you prescribe them something different, they challenge you because of what TikTok told them. What is your sort of experience with this, and how do you feel we should deal with it? Because it's not going away. It's only going to get worse. So how is your experience? Have you come across this? And if so, how are we dealing with this?
Never. My patients are so respectful.
Where do you work? I want to come there.
It's, opinions are like assholes. Everyone has one.
That's great. That's great.
Constantly, every day. We had a couple of patients just last week. Someone who wanted regenerative medicine, but never provided X-rays, but heard on Rogan's podcast that it's a great thing to do. Yeah. I'm not saying it's not. But, and then of course, you can probably find evidence that something is good for you if you want to. If I looked up right now, can I lose weight by eating candy? I'm sure there's research that shows you can't. Research, right?
Right, research.
I'm putting this in quotations.
Yeah.
So the best thing they can do is hear them out and never treat patients like they're stupid, because they're not. They're very smart and they know more about their own bodies than we know about their bodies.
Yeah, that's so true.
So treating them with respect and meeting them where they're at, and then maybe questioning what they are saying and provoking a little bit more thoughts.
Sure. So it sounds like meeting them halfway. Instead of saying no, absolutely not, and combating them, saying, hey, I understand. Let me walk through what you've learned. Let me walk through my expertise, and let's kind of figure out a middle ground. That's actually a great way to come across that. In terms of this, do you feel like it's clinics' jobs nowadays to start putting information out online?
Yes.
I mean, there's a lot of, like you said, some of the old school physicians out there that are, maybe resistant towards social media, resistant towards conversations digitally. Do you feel that it's important now for the establishments to kind of take a stance and say, hey, listen, I'm going to now publish my own content. I'm going to get on social media. I mean, I know you and your counterpart, Nolan, have been doing an amazing job of educating your community. What are your thoughts about kind of the clinics that might be watching and if this is something they need to take initiative for?
With great power comes great responsibility.
I love that.
And yes, we have to. If you are not doing this anymore, you're not doing your job. There's this concept. If you are a doctor, sure, you can impact 1 or 2 or 3 patients' lives, and that's really exciting. But if you right now, because of social media, you can put a podcast out there or put something on social media and impact literally millions of people. And that's so powerful. So yes, there's going to be tons of information that's BS, but it's our job to call out the BS and not be afraid. Mm-hmm. And hopefully people are smart and intelligent enough to sort through all the BS and find the right information. We have to. It's our responsibility.
It is. And that's why I love this sort of conversation is for us to talk about these main topics and to do our best to kind of shed light. I don't think there's anyone that's right or wrong. I definitely think there's people that have lots of opinions, just like you and I. But I do think there is a lot of BS and calling it out. I think that, hey, opioid is a crisis. There's no putting a bow on that. There's no making it look pretty. It's a problem. I'm glad there's a new medication. I'm glad there's alternatives. Conventional medicine is necessary, but functional medicine is also necessary.
Sure.
And us shedding light on that, amazing. And I think that this conversation, of course, is important for us to continue to influence. So I appreciate that. Any last thoughts, anything that you would want, the audience out there to know in terms of, hey, listen, medicine is evolving and we can do one of 2 things. We can either say, no, that's not right, or we evolve with it and we educate ourselves, we invest in learning, we invest in new therapies, we invest in technology and proper resources for our patients, or do we stay stagnant? I mean, what is your advice?
If you stay stagnant, you are going to go backwards. I read research that showed that it takes about 70 years for the medical system SOPs to actually change.
Wow.
So, of course, we are very behind right now. And if you are not reading, if you are not reaching out to other providers, you are doing yourself and your patients huge disservice. I'm going to a longevity conference in Zurich in April because I want to know more. I want to see what people are doing around the world. What we're doing is not wrong, but can we do things better? And I think we can.
I love that. And I think it's absolutely, we have to go and educate ourselves, and especially going around the world, because it's not just the US, but taking the knowledge from all the other countries. And you're absolutely right. The hottest topics are regenerative medicine, rehabilitative medicine, functional medicine, exosomes, PRP is coming back into the conversation. These are all things that our body has that's natural that we can now optimize. And if we're not going to these conferences and if we're not having these conversations, we're stuck in our own ways. So we have to get out just like you did today. And I appreciate your time. Dr. Dom, it's been amazing. I appreciate you coming on. And for those of you that are interested in learning more, or if you have questions, I always encourage optimistic, positive conversations in the comments. If you're new here, make sure you subscribe because, hey, how often do you get moments to learn from experts like Dr. Dom? And I want to learn from you. So we look forward to having you on the next conversation. Make sure you hit that subscribe button. Thank you for joining us, Dr. Dom. Thank you for joining me.
Thank you so much.
Take care, guys.